First speaker is Dr. Wavikar. He is going to talk on comparison of clinical parameters in two different IOP settings in active century in cataract surgery. Dr. Wavikar, please. No, I can't hear you. I can't hear you.
Hello.
Now I can hear you.
Good morning, everybody. I am going to talk on comparison of clinical parameters in two different IOP settings on active Centurion machine. It was funded by Alcon. All the ethical and legal considerations were met with. The aim of the study was to evaluate the benefits of active sentry in low, that is 20, versus high, that is 50 millimeters of intraocular pressure during phacoemulsification. The primary endpoint was comparison of CCT, central corneal thickness on post-op day 1, whereas exploratory endpoints were endothelial cell density, active surge mitigation, BCV है, आगे नहीं जा रहे हैं. Mean CDE, US time, patient comfort, and antechamber flare and sales. Materials, it was a prospective, comparative, double-arm, randomized, single-blinded, interventional, single-center, single-surgeon study involving 112 eyes, two groups of 56 each. The control group was 50 IOP and the interventional group was 20 IOP. Inclusion criteria, standard, well-dilating pupil, grade 3 cataract, and no other complication, where any post-op complication or intra-op complication, the cases were taken out. Results, you can see that demographically both the groups are very well matched. Phacoemulsification parameter, again USG and CDE is both equal. There is no statistically significant difference. Central corneal thickness, of course there was an increase in the thickness up to 3.5%, but the difference between the two groups was not statistically significant. Endothelial cell density, again there was on an average loss of 3.5% of the cells in both the groups, but there was no statistically significant difference between the two groups. Active surge mitigation, over here we found lot of difference. In 20 IOP group, it was initiated only in 12% of the cases, where as compared to 43 in 50 IOP group, which is statistically significant. Even the number of instances were much higher in 50 group as compared to 20 group, which is again statistically quite significant. Pain comfort, no difference between the two groups, CDVA, no difference. So in a nutshell, there was no difference in any parameters except ASM, that is active surge mitigation, which was much lower in 20 group as compared to 50. Now we have been doing cataract surgery with a high bottle height, to reduce surge and complications like PCR and corneal endothelial damage. But that also has its own flip side, that is subtle ocular ischemia, inflammation, difficult surgical maneuvers during deep AC, etc. Prior to development of Centurion vision system with active sentry technology, there was no suitable technology available for risk-free low IOP cataract surgery. In Centurion, we have active sentry, that is a quick wall technology. That means there is a shortcut for reflex mechanism, and therefore we have what is called as ASM, that is active surge mitigation. Even if there is a microflutter, ASM kicks in and that is avoided. Now there are three factors which affect this. Number one is surgical techniques, but it was a single surgeon study. Eye anatomy, patient on the groups were matched, and so the only difference between the two was the machine setting, that is the IOP setting. And therefore we can safely say that low IOP is significantly safer as compared to high IOP, because of as far as ASM instance, that is microflutter is concerned. And microflutter obviously will mean that of course the major flutter also won't be there. So what we feel that when we lower the IOP, we are worried that we'll get surge. Here the situation is different. You can safely do surgery with 20 IOP. Now it is not possible to use 20 IOP in all the patients, but you can say most of the patients. So conclusion, it is equally safe to perform cataract surgery with near physiological or 20 millimeters IOP in comparison to 50 in Centurion vision system with active sentry technology. As far as the anterior segment surgery is concerned, we did not go into the posterior segment as far as the complications or problems are concerned. 20 IOP cataract surgery using active sentry causes much less AC fluctuations, which is the major cause of concern for any surgeon who is doing cataract surgery, and therefore it provides much safer milieu for cataract surgery. Thank you.
Thank you. Do you have? We don't have a discussion in this, no? In prepare. You can ask questions. Dr. Wavikar, even if there is, if the anterior chamber is shallow, or if there is thrust, or the patient squeezes, will you keep the same IOP of 20? I've also got an active sentry, and I feel it's safer to remain at 30 or 40 in these cases, especially when you have problems, because you don't want just to lower, just for the sake of lowering the IOP, you get into trouble with a PC rent, because even little higher IOP, we have not seen optic nerve damage and other things which the company talks about.
Yes, sir.
So I feel that the safety of the patient is paramount. Whatever IOP you have to safely keep for that particular surgery.
Yes, sir. Very valid point. Actually, this is what the study concentrate on, that even at 20 IOP, there is no surge and flutter. At the same time, as I said, that it is not possible in every patient. Say out of every 20 patient, one patient comes when there is so much of fluctuation that you better shift to 30 or 40 IOP. What we have seen is endothelial loss and CDVA, corneal thickness, everything is unaffected when we use 20 IOP. Another point is that there is a lot of learning curve. See, from 30 to 20, to reach from 30 to 20, I took as many as 6 months. And I had to manipulate the aspiration flow rate, vacuum. Luckily in Centurion, we can have 3 settings for vacuum, 3 settings for aspiration flow rate. That is pre-occlusion, occlusion and post-occlusion. And all these things were manipulated, and that is how I came to these settings.
Did you include very hard cataracts, 4+, 5+?
No. This study was only for grade 3 cataracts and below cataracts.
And you were able to complete all the cases with 20 IOP?
Yeah. Yes. As I said that, ma'am, out of 20 patients, there comes one patient where 20 IOP is not good enough, and we have to increase the bottle height to 30 or 40 IOP. But majority of the cases, if we set the parameters properly, it is possible to do the case without any risk or endothelial damage or PC rent.
I think we will go to the next speaker, because this is an endless sort of topic.
Yeah, thank you, sir.
Thank you. Thank you.